Morning, everybody. We're here with Hanna at Lauderdale Veterinary Specialists. This is Amy. I received a call early this morning that Hanna had a severe nosebleed, and it was bleeding from 7:30 to 9:30 on and off. So she has a textbook case of Ehrlichia. Her white cells are super low. Her PVC has been staying at 8% after 2 blood transfusion, and the normal blood is 35 to 40. They have ran every test imaginable. They have x-rayed. They have done at least a half a dozen of ultrasounds. When I spoke to the doctor this morning, her recommendation was euthanasia. When myself and Tiffany arrived here, they brought her in a room, and she came straight towards us, rested her head in our hands, and just pressing for love and attention. We don't see any signs of discomfort, pain, suffering since we've been here for, it's been at least a half an hour. There has been no bloody nose. There's been nothing. Bleeding is a sign, one of the signs of Ehrlichia side effects. And after speaking to Dr. Cannon, who is a specialist here, internist, she wants to start her immediately on steroids. So we have a lot of things going on with Hanna. I'm not going to lie to you. When driving here, in my mind, I was coming here to say goodbye to Hanna. And after being here, Tiffany and I and the doctors talked about it, and we would never let a dog suffer, but we've gone this far, and we want to give her every chance to say that we've tried everything. So we are going to start her immediately today on steroids. You can see on her legs the blood from her bloody nose this morning. She also has a very dry cough. Who knows what's going on inside of her, honestly. Her appetite is really well. She's peeing, she's pooping. She had a little bit of diarrhea yesterday, and they gave her some metronidazole to help with that. This is just so heartbreaking for our team that we've been so invested and grown to just absolutely love her so unconditionally, like she's one of our own in our home. She's never had the experience that we know of to know love in a home environment. There's nothing more than that is what we want for her to have. Sometimes with all of our plans and, hopes, sometimes it's just not up to us. So we're not going to talk about euthanizing her today. We are not going to do that today. It is Monday. It has been a very, very exhausting weekend for us between all the dogs that we've rescued, the critical cases. And we did spend time with Hanna yesterday, and we showed you the update video. She was eating meatballs, and she loves her visits. There's just something in her eyes and her face that I wish she could speak and tell us what she needs and what she wants. We're just going on the signs right now. We have all decided we are going to do the steroid route and see if there's any improvement, and pray and hope that there's improvement. She's still a young dog, and she has such a beautiful, beautiful soul. We want to give her that chance to know love, unconditional love. She's been at the hospital here now for 2 weeks since our team rescued her from the Miami-Dade Animal Services kill shelter. And we wouldn't change a thing. It just breaks our hearts of all these dogs that are in these conditions. And, rescues pull these dogs, and they invest their love, their hearts, and not to mention the thousands and thousands of dollars. And, we've been asked, why would you spend that kind of money on one dog? Because every life matters. Maybe that is what separates us from others, but that is who we are, and we are not going to change who we are for nothing and for nobody. Mm-hmm. Hi, Mommy. What? Where you going? Where you going? Taking a stroll? Huh? You taking a little stroll, Hanna? Come here, baby. So we wanted to update you on our Monday morning. It is early. Go get Tiffy. Go get Tiffy, Mommy. Go see Tiffy. Hannah, come here to me. Come here. Come here. Hi, babe. Go on. You can do whatever you want. You want to come here? Okay. Okay.